I appreciate the opportunity to talk to you today about bile duct injuries and the moderators for this great session.
Forward?
Yes, ma'am.
And that's the laser pointer, and that's back.
So don't have anything to disclose. So approximately 1 million of patients develop gallstone-related disorders annually in the United States, and 750,000 undergo surgery. In the past 25 years, laparoscopic cholecystectomy has been the gold standard for the treatment of gallbladder disease due to improved patient outcomes, reduced pain, faster return to normal activities, and reduced risk of surgical site infection. So this is what I was talking about, that the complications have not changed significantly over time, and about the incidence of bile duct injuries. It's important to translate these incidents, even though it's not that common, right? So 2 to 4 in 1,000 patients is not that common, but because of the number of cholecystectomies we are performing in the United States, this translates to 3,000 patients approximately a year, or 50 a week. When you look at it that way, it feels like a big number, and it is a big number. And it's also known that the rate of bile duct injury when we transition to laparoscopic cholecystectomy, and currently is about 2 to 4 times higher than that for open cholecystectomy, depending on what data you look at. So bile duct injury is a worldwide issue. I put up a busy slide just to show you that it's been reported in pretty much multiple countries, and the incidence reported is also very similar, with some little variability, but they're very close. Another argument that you should be aware of is that the bile duct injuries are probably underreported. A systematic review that looked at this and aimed to identify the range of complications reported in laparoscopic cholecystectomy studies included 233 studies and identified 967 complications, of which 21% would define what they were. This is a very small percentage, but only 33% of papers reported bile leaks, and only 32% of papers reported BDI. And given that this happen, especially when you have a big series, there tends to be the suspicion that there's underreporting. Important from your perspective as a surgeon who performs cholecystectomy is that most of you will encounter, if you have not already encountered, a bile duct injury. Data from multiple countries reveal that 1/3 to 2/3 of surgeons will have or have had a bile duct injury. The bile duct injury risk is higher in the early experience of a surgeon. However, it's also important to understand that this risk does not go away as you become more experienced. There's actually a number of studies, both from the US and Europe, that show that 1/3 of the bile duct injuries are actually committed by surgeons who have more than 200 laparoscopic cholecystectomies under their belt. And, as I mentioned earlier, also survey data from different countries suggest that the bile duct injury risk has not changed significantly over time. So what is the impact of bile duct injuries? Patients who suffer bile duct injury will typically require numerous interventions and hospitalizations, will have a number of complications, and do have an increased short and long-term mortality, as well as a low quality of life. Bile duct injury creates a significant economic burden to our healthcare system, with an estimated annual cost of more than $1 billion. And BDI is also the most common reason for medical legal litigation against general surgeons, just purely by the fact of the frequency of these procedures. A study published by members of this society and the Safe Quality Task Force looked at the outcome trends and safety measures over the past 30 years in a systematic review. They looked at 151 studies that included 500,000 patients. And the overall morbidity was ranged from 1.6 to 5.3%. The bile duct injury ranged from 0.3 to 0.5. And the mortality rate was, as you can see, 0.08 to 0.14%. In this particular study, there was some decrease in the bile duct injury rate over time, even though, as I mentioned earlier, a lot of other studies have suggested that that has not changed. This could be encouraging, but the morbidity rate has not really changed significantly over the same time period. This is 5-year time frames that they compared. Another interesting study looked at the long-term outcomes of patients with common bile duct injury following laparoscopic cholecystectomy. So this group looked at 150,000+ lap choles from New York State between 2005 and 2010. They had follow-up of 4 to 9 years. They identified 125 bile duct injuries, which had a 0% 30-day mortality. However, there was a 20% all-cause mortality with a mean time to death of 1.6 to ±1 years. And when they adjusted that to the expected mortality rate for the same patients, for the same patient group without a bile duct injury, they noted that the patients with bile duct injury had an 8.8% higher risk of death. Litigation is also important, as I mentioned earlier. A study that looked at medical malpractice cases in New York between 2004 and 2017 examined 46 cases, of which about equal number, 43%, had a favorable outcome for the plaintiff and another 4% for the surgeon. And the victory payment was $700,000, while the mean settlement was over $1 million. Bile duct injuries were the most frequent, the most common reason for this litigation in 43% of the cases. And you can see the payments. So I will complete my presentation with a few take-home messages. I think you have several very interesting presentations to follow and how we can prevent this. So bile duct injuries, while infrequent, continue to occur in 2 to 4 patients in every 1,000 cases you do. And because we do so many, that ends up affecting a lot of our patients. The incidence is likely underreported. They affect all surgeons, not just the inexperienced. They can have a devastating impact on the patient, increasing their mobility and mortality and decreasing the quality of life. And bile duct injuries do present a significant cost burden to our healthcare system and drive surgeon litigation. These are some references. And I don't know if we're doing questions now or later. Thank you.